I wanted to talk about like the reconstructive versus the aesthetic practice. What kind of conditions and patients do you see in an aesthetic practice versus like a reconstructive practice?
Got it. Yeah. So my practice right now is essentially 100% cosmetic, but it wasn't always cosmetic surgery. So in addition to my plastic surgery training, I also did training in hand and microsurgery. So when I first got out, I was doing some recon, some hand, and some cosmetic, and then gradually, for different reasons, my practice has now become cosmetic. But as a reconstructive plastic surgeon, really any part of the body that you can imagine, we deal with scalp reconstruction, reconstructing ears, noses, lips, breast reconstruction, lower extremity reconstruction. That's the part of the beauty of plastic surgery is that you don't have to be pigeonholed into one particular thing. You know how to operate literally on every part of the body and just about any part of the body you can imagine. During my training and during my practice, I've done some type of surgery. So I think the most common reconstructive procedure for plastic surgeons is probably breast reconstruction. With the there's unfortunately a lot of breast cancer, so there's a lot of breast cancer surgery and thus a lot of breast cancer reconstruction.
And you also mentioned that you did general surgery before doing your plastics fellowship. What do you think of these new kind of integrated programs where you just go right from medical school into plastic surgery?
I think they're great, actually. I think it's actually, in many ways, a better model than what I did. So there's integrated and non-integrated plastic surgery programs. So my model was I did 5 years of general surgery, and then after that, I ended up doing a fellowship, which was 2 years of plastic surgery. And the field of plastic surgery is so broad, because you can literally operate from head to toe that you could make the argument that just doing 2 years of a plastic surgery fellowship may not necessarily give you as much experience as someone who is in an integrated track. So the integrated track is finish medical school and you go directly into a plastic surgery residency. And that program is usually about 6 years, but you're not doing 6 years of just plastic surgery. You're doing, your intern year, you're rotating on every different service in the hospital, but you do some plastics. Your second year, you're doing a lot of general surgery and you do some plastics. And then as you get into your fourth, fifth, and sixth year, you're really just focused on plastic surgery. So I think it's a superior model to the program that I went.
Did you feel prepared to practice plastic surgery after doing only like 2 years of fellowship and all of your general surgery training?
Yes, but probably not in all aspects of cosmetic surgery. So, when you train as a plastic surgeon, you're not doing just cosmetic surgery. You're doing a lot of reconstruction and some cosmetic. So, and different programs have different strengths and weaknesses. So, my program actually had a lot of cosmetic surgery in it, surprisingly. But for example, we didn't do a lot of rhinoplasty surgery. So when I got out, I didn't have a lot of experience, and I did a few. I did those surgeries along with experienced colleagues who were there to kind of just be on the safe side. And I never really kind of got into it, and that's kind of phased out. So there's certain things that I didn't have a lot of experience in, and so those are not a part of my practice at this point.
Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.